Hi, one of the questions we also get asked a lot is, should my child be in a center-based ABA program or a home-based ABA program? The answer to that is usually it depends. There are pros and cons to both, and it really depends on the learner and your schedule. Some of the advantages of a center is that parents can drop off depending if they have busy work schedules, they're not available to be home, they could drop the kid off and pick them up at the end of the day. The kids are able to deal with distractions. They're working in a busier and a noisier place. That could be a pro or a con, depending on the child. Something that a center-based would be able to offer is a small group. If your child is ready to learn in a small group, then that could be a really great option. Some of the advantages of being at home would be that parents can be involved. If they're home anyway, then they can see how the therapy is happening and then hopefully be able to carry that over into the home setting, and you'll see lots of generalization happening when the parents are involved. We find that therapy moves a little bit faster at home just because there's less distractions. The therapist comes and is there just for your child, and they're able to advance the program quickly. Overall, we find that for home base is really great for a young kid, a really early learner who really needs that one-to-one attention. The con is that they may not get socialization at home, but if they're really young, they may not need it. A center-based, I usually recommend for a child who might be a little bit more ready and capable to handle the distractions and the noise and the group. And they might be ready to learn in a small group because they already have the prerequisite skills that they worked on at home. And remember that a combination of the two is always an option. You could do a little bit of both. You could do some home-based, and then when they're ready to graduate into more of a center-based, some days to work on socialization, that's also an option. So talk to your AB provider, your BCBA, and hopefully they can help you find the best option.